everybody. I'm Kelly with HealthyPlace.com. Today we're going to talk about some mental illness and misdiagnosis and what you can do if you feel you've received an incorrect diagnosis. You can find out specifics and criteria about how to diagnose mental illness on HealthyPlace.com. So our first guest today is Megan Griffith, who is at Healing Unscripted here on Instagram. She was misdiagnosed and does not completely agree with her re-diagnosis. She's a mental wellness coach, and she uses her own experience with mental health issues to help others. Then we'll bring on psychologist Dr. Kristie Norwood, and we will talk more about misdiagnosis and answer your questions. So hi, Missy. Hi, everyone. Hi, Dr. Norwood. It's good to have you here today. And if anybody wants to type in their questions, comments, experiences, our guest will get to them as we go along. Let me see here. Okay, let me bring on Megan. Megan was misdiagnosed with bipolar disorder in 2014, and she's not really thrilled about her current diagnoses. It's anxiety disorder and depression related to childhood trauma. And as soon as she can get back to her therapist, she plans on discussing her diagnosis again. Hi, Megan. How are you
today?
There.
I'm great. How are you?
I'm good. You've got a little feedback going on over there. Do you have a computer on next to your phone?
Let me try. How are headphones? I know that wire is in the way, but
I think that's better.
Okay.
Great. So you were 19 when you received your first mental health diagnosis of bipolar disorder. And how old are you now?
I'm 26.
26. Okay, so we're looking at 7 years that this has been going on. You mentioned to me in the pre-interview that you were sure you had bipolar disorder because, quote, bipolar felt as extreme as I felt. So did I get that right? Yes. Bipolar felt as extreme as I felt. So what made you so sure that bipolar disorder was the problem?
Well, I had sort of the textbook experience when it comes to the stereotype of bipolar, like the stuff you see in the media, which is really fast mood swings and going up and down every day, all the time, which, once I got diagnosed with bipolar and started learning more about it, I realized that's not what bipolar is at all. So, I basically had mood swings, and to me, they felt so severe that there had to be something wrong, some sort of disorder, and bipolar is the mood swing disorder, right? So it just made sense in my brain.
Yeah. Okay, everybody, remember, share your comments and your questions, and we'll get to those. So when did you start to doubt your bipolar diagnosis?
I think I doubted it the entire time because I have issues with validation. To me, it was like the bipolar diagnosis would have been a huge validation of my struggle. And so, sorry, my baby's here with me. The bipolar diagnosis would have been a huge validation of my struggle, which meant I had to constantly doubt it in order to feed in with how I felt about myself at the time. But then I started to genuinely think this might actually not be the right diagnosis for me. When I started working with a trauma-informed therapist just by happenstance. I didn't mean to. She was just the only one available in my area. And started to realize that my mood swings were not as random as I thought they were. They were triggered.
Interesting. So your mood swings were triggered, much like an anxiety would be triggered. But did you ever swing into a positive mood, or was it always swing into a negative mood?
It is probably both, to be honest, for me. My positive moods and my negative moods both can come they feel sort of random to me. They're very intense. I can go 1 minute being fully, completely, actually depressed. But, you know, the typical definition of depression is it has to last at least 2 weeks, and mine just never do. Mine last a couple hours or a couple days, but it's the full depths of despair that I'm feeling. Um, and then when I'm happy, it swings all the way up, and it's not necessarily into an unhealthy version of up. And I think that's part of why I always sort of doubted the bipolar diagnosis, because I was never really manic. I just was like actually okay.
How would tell me a little bit about how you went into getting the bipolar diagnosis? Were you insistent with your doctors on what was wrong, or how did they come to agree with you that you were bipolar?
I think a lot of times the trouble with mental health diagnoses and everything is that we rely on our explanations and our descriptions of our symptoms. And so to me, I thought that I had bipolar. So when I was describing my symptoms, I didn't say I have a history of trauma. I didn't say any of these other things that I thought were irrelevant. I said I have really bad mood swings, and I go from not acting like myself because I'm depressed to not acting like myself because I'm clearly manic. And they believed me because I believed me.
Right. Right. And were there treatments when you were bipolar that you were doing that just didn't fit what was going on with your diagnosis?
Absolutely, yeah. We tried a lot of cognitive behavioral therapy, or CBT, and that turned out to not be super effective for me because of my history with trauma. It felt very invalidating. Instead of learning how to control my emotions through understanding them, it felt like I was learning to control my emotions through shutting them down, which triggered a lot of stuff for me based on like years of invalidation and it's stuff like that. So yeah, that ended up not being overly helpful.
That makes sense. So when were you re-diagnosed, and what are you diagnosed with right now?
Let's see. I saw the therapist, the trauma-informed therapist who helped me realize bipolar was incorrect, but she never really gave me a new one. We were working through it until insurance changed and, you know, all that stuff. So I think my next diagnosis was depression and generalized anxiety disorder. And currently I'm diagnosed with depression with a history of childhood trauma.
So what is it about, because you mentioned that you were going to talk to your therapist again about the diagnosis, and what is it that, how do I'm sorry, I lost all my words.
Oh, no, you're fine.
What is it about the illnesses you're diagnosed with now that just doesn't fit right with you?
Actually, what I'm diagnosed with right now feels pretty right. It's more that I'm worried that something additional might be going on. So for the first time, I actually feel like what I'm diagnosed with feels correct, which is crazy and very validating. It feels very good. But I do wonder if my brain is like neurodivergent in some way, so like ADHD or autism, because I just really resonate with that stuff. And I know a lot of that overlaps with trauma. So I'm trying very hard not to diagnose myself this time because it didn't go great last time. So I'm leaving it to the professionals, but I'm curious. I'm trying to stay open, and I feel like those could potentially be avenues for me to explore.
So how will you know for yourself when you're correctly diagnosed?
I think it just feels right. Like I said, right now, for the first time, it just feels right. And that hasn't been the case since this all started. So I know that's really vague and not very helpful for people listening, but I'm learning to listen to my intuition more, and my intuition is telling me that I'm on the right track.
Do you still plan to have some of those psychological tests performed when you go back?
Yeah. And I'm seeing my therapist just virtually, but yeah, once we go back to in-person, I would love to be tested for ADHD or autism or something like that.
Okay, cool. Let's see. What has been the most difficult part about living in this kind of a gray area for you? You know, not really knowing everything.
Oh gee, the most difficult part I think is just the level of obsession that it can get to, at least for me. Like I have a very like obsessive personality sometimes and sorry, hold on. Baby. No. Um so I tend to get very obsessive, and when it was at its worst, I was probably thinking about my mental health and possible diagnoses, I don't know, 10 hours a day. It was really extreme for me. It was a lot of time spent um, just panicking, basically, just freaking out about what do I have? Where is the proof that I'm not just a horrible person? That's how I was using diagnosis for a long time. It was like, I need to be diagnosed with something to prove that I am not just objectively terrible.
Sorry you felt that way. That's really rough. I don't really know what to say about that, but I don't get the sense that you are objectively terrible. I have the sense that you're a very good person. So, I guess, is there anything else that you would like to tell everybody about living with a misdiagnosis or trying to get a new one? Like, would you ever insist on a certain diagnosis? How would that work?
So I think, knowing what I know now and based on my experience with misdiagnosis, I would not insist on a diagnosis again. So like I said, I'm trying to stay very open and listen to my doctors. I listen to my intuition as well, but trying to find that balance.
Right.
But that being said, I think I had to insist on the bipolar diagnosis because that's where I was in my journey. I don't think I could have done anything differently. Unfortunately, I wish I could do everything perfectly the first time around, but it doesn't. Sometimes you learn through mistakes, and this was a really big one. Like, I do think that my misdiagnosis was somewhat traumatizing in some ways, so it was definitely hard, but I don't think I could have done it any different.
That makes sense too. And is there anything that you want to tell everybody about this experience of yours? Like, do you have any tips if somebody feels they're misdiagnosed?
I think if you've experienced misdiagnosis, first of all, my heart goes out to you because it truly is a lot harder than it sounds. It doesn't sound like that big of a deal, but it really can be, especially with mental health, because it feels so tied to our identity. So the first thing I would want to say is just, I'm sorry that you're going through this and you're allowed to be upset about it. And then the next thing I would probably say is keep trying, because it's not that something is just wrong with you. It's not that you're this horrible, terrible person that no one can figure out. It's that human beings are complicated, and you are a human being. You are entitled to those complications. You're allowed to be complex. And diagnosis is, my doctors always said this to me and I never listened, but I'm going to say it to you anyway because I do think it's true. Diagnosis is an art, not a science. And you got to give it a little time. I know that's frustrating and probably not what people want to hear. I know it's not what I wanted to hear, but it's what I needed to hear. So
that makes sense too. I really appreciate you being on today, Megan. And I wish you well on your diagnosis journey. And if there is anything neurodiverse about you, I hope they find it.
Oh, thanks.
You're welcome. All right. Thanks, Megan. I'll talk to you later.
Okay.
Bye. Let's see, there we go. My phone's not working. Now, Megan, my phone screen isn't working. I don't think you can. That's weird. There we go. I'm sorry. So our next, remember, I see that Sonia said being misdiagnosed is very hard, and Missy was misdiagnosed twice and have a new assessment on Monday. And when I bring our next guest on, I will talk about that a little bit. And our next guest is Dr. Kristie Norwood. She is a licensed clinical psychologist who serves as the director of a university college counseling center. She's passionate about ending mental health stigma, and what it was. And you can find out more about her if you follow at Dr. Kristie Norwood, DR for doctor. Let me bring her on. Hello, Dr. Norwood. Can you hear me? Are you there? Not yet. Her phone must not be catching up yet. So remember that if you need some help or want to know what diagnosis criteria is, you can always go to HealthyPlace.com. We have a bunch of information from the DSM-5 on how to do that. Can you hear me now, Dr. Norwood? There we go. There we go. So thank you for coming in today to talk to me about all this. And I received some information that half the people with a mental illness are misdiagnosed. Is that true? She's stuck again. At least on my part, I can't hear her. Give it just a second here. Nope, she'll come back. She's going to try that again. I know she will. So you guys out there, what have you been misdiagnosed with? Is there anything in particular that has caused you trouble? And do you feel like you're correctly diagnosed right now? There she is. She's back again. Go live. Let's see if this works better. How's that? Bipolar, then schizophrenia. Thank you, Missy. Dr. Norwood, can you hear me? No sound? Oh, okay, okay. So let's try it. Maybe you can hear me better than I can see you. Um, let's see. Like I said, it's been told to me that half of all people who are diagnosed with a mental illness find that diagnosis to be incorrect. Is that because of inaccurate reporting from the patient? Is it because so many people are being treated by their primary care physician instead of a psychiatrist? Is that a combination of both? We are having a difficult time with Dr. Norwood today. I'm sorry about that. Missy, which diagnosis were you more comfortable with, bipolar or schizophrenia? And see, we'll try one more time with Dr. Norwood and see. She might be having internet problems or power problems out there where she is. Hi, Bonnie, and hi, Celeste. All right, she says, third time's the charm, so let's give it a go. I'll send you the request. You're not comfortable with either of them. Hey, I bet this works.
I decided I just should go outside because the internet was not cooperating inside.
Well, thank you. That's okay. Let's see. All right. Why are people misdiagnosed?
Yeah,
With mental
so,
health?
I think Megan did a great job of kind of helping us sort of understand this piece. But one of the big things with misdiagnosis is it's such a process. So oftentimes, we kind of think we come in for an appointment with a therapist or a psychiatrist or a physician even, and we think after 45 minutes or 60 minutes, they'll automatically know everything that's happening. And oftentimes you can ask your provider, is this a working diagnosis? Is this what we call in the mental health field a provisional diagnosis? So, when I meet with clients, sometimes I think it might be bipolar, but I really need, 2 or 3 or 4 more sessions just to identify exactly what is happening. And so, I think it's important to write down also sort of what you identify as going on. So like Megan was saying, she didn't necessarily think it was important or relevant to share a history of trauma. And so she didn't. And so even before your appointments, you can write down, okay, these are the highlights, right? And just know that going in, it will be an ongoing conversation. And the provider, it might... So similar to the internet, right? It might take a few times for things to kind of cooperate and sort of do what they're supposed to do. But I think the biggest piece is really just like knowing that it's so important to have patience and that it's a process where you all are working together. So while the client is definitely the expert on himself or herself, the therapist is really working and using their knowledge to try to make sense of if there's a diagnosis, and then if there is a diagnosis, what that diagnosis actually is.
So it doesn't sound like you're going to go into something and the first diagnosis is something you can like hang your hat on if you're doing a working diagnosis, right? So is it something to be upset about when the diagnosis changes?
I'm not sure that I can share with anyone that it's okay or not okay to be upset. I think it can be really frustrating. So I think if people feel upset or frustrated about it, I think that's totally valid and totally okay to feel, because you're going there in search of answers, right? Like I want someone to tell me what is happening, make sense of my feelings and thoughts and behavior. So, I think those emotions that people tend to feel are very much valid. But the biggest piece I think to remember is to be really forthcoming with information. I think, sometimes we don't want certain diagnoses. We may have, gone to Google, and treated that as our psychologist or psychiatrist for so long, and we're afraid of certain diagnoses, so we may hold back, or we may not think that certain pieces of information are that important. And so it's so important for when you're going to see a practitioner, a mental health provider, just to be completely honest as you can with the information and as best you can. And if you don't know something, oftentimes I'll share with my patients, if you don't know how often you're sleeping, or if you don't have a sense of exactly what your mood is, that's okay. Let's track this for the next week and let's sort of see where this kind of leads us together. But it's okay to be upset. It's okay to be frustrated. And it's also okay to communicate those feelings openly to your provider as well.
So Misty Klein, she is on the call right now, or she's watching right now. Yeah. And she says she was diagnosed first with bipolar, then with schizophrenia, and she's not comfortable with either of those diagnoses, and she believes she has PTSD with psychosis. So, what I'm seeing in that list is a lot of overlapping symptoms that can be, because bipolar can have psychosis and PTSD can have psychosis, and of course schizophrenia, it's based in psychosis, if I'm right about that. So what kind of illnesses are often confused or misdiagnosed?
Yeah, I think so. What we call our mood disorders can often be confused. So for example, commonly we talk about depression and we talk about anxiety. There's a lot of overlapping symptoms between the two. You can also have what we call major depressive disorder with anxious distress is kind of the big term that we use. And so that means, wait a minute, I get depressed, and then sometimes when I have high periods of stress, I also experience anxiety. And so sometimes with those mood disorders, as well as, as you're kind of sharing with some of our diagnoses that may involve hallucinations or delusions or or different sort of thought patterns, sometimes it can be hard to tease some of those out. I think an important thing for viewers to know is we have what are called kind of qualifiers. So someone can be depressed, and as you mentioned, they can also experience psychosis within that, right? So then it's a question of, okay, is this really psychosis, or is it depression with psychosis? And so that's where it takes time. And also with these diagnoses, while clients have been living with them for some time, mostly, oftentimes it takes us as providers, at least like a month's worth of time to be able to see patterns, to be able to notice what's happening, to be able to establish a relationship where the client feels comfortable enough sharing information with us. And so it can be really hard for providers to discern exactly what's going on based on one visit. Sometimes with some of my clients, I will pull out what we call the DSM. It's kind of like the Bible for mental health providers, and that's how we determine, is it major depression with psychosis, or is it schizophrenia? And so, I think it's okay to ask your provider, and I think we really should encourage clients to do that. How did you derive at this, right? Because if someone was going to say, Kristie, I want you to have surgery on your heart, I would want to know, why am I having surgery on my heart, right? And so your mind is just as valuable as your body. So it is very, very healthy to ask some of those questions of your provider. What diagnosis do I have? What made you come to that conclusion? Can you tell me why you think it's depression versus anxiety? I'm also having these symptoms. How are they captured or not captured within this particular diagnosis? So I think some of those questions are just really integral to establishing the relationship, but also really understanding what's happening.
I guess you mentioned earlier, not wanting to have a certain diagnosis. And there are diagnoses that are heavily stigmatized. So yeah. I imagine you're not doing yourself any good trying to avoid those symptoms. But how could somebody allow themselves to tell everything? What does it take to be able to trust that doctor all the way?
Absolutely. I think it takes time, Kelly. I really do. I think it takes a lot of time to feel like you can trust someone with information that you likely have not shared with anyone else or with very few people. And so time looks different for a lot of people, but that might be, 2 or 3 appointments, right? Again, I'm definitely an advocate of writing things down. One, because our memories sometimes fail us. If you go to the doctor, you think, oh, I need to tell them this, that, and the other. And then you leave and you're like, oh my goodness, I forgot to share this information with them. And so I think being able to write that information down can be so helpful. And it can also help just to feel more comfortable, right? So now I'm looking at a piece of paper and talking about my anxiety and my concentration, as opposed to actually having to look someone sort of in the face as I'm talking about that. But that, that avoidance, it definitely works, right? Like it works to avoid, thinking that we have these symptoms or these diagnoses. It works for a short period of time, but unfortunately, eventually, that avoidance will catch up to all of us.
Well, I'll let you have the last word. Is there anything else that you think it's important to know before going to the psychiatrist or therapist?
Yeah, I think the biggest piece is just to know that, one, there may not be a diagnosis, right? So there are people who experience symptoms, for example, of depression, right? They might get sad sometimes. They might have difficulty concentrating without it actually being a full-on diagnosis. That's why we have to be careful with Google and the like. And so I think that's one piece that's important to know. But I think it's also important to know to be really patient in the process, because it really is a process. And as Megan said, we are complex human beings, right? And so when I spend 45 or 60 minutes with a person, sometimes I don't know for sure. I might have 3 working diagnoses, and I will share with them over time. We'll figure this out together. And I think the other piece is just to be willing to kind of take that leap of faith to share the symptoms, even those that you're afraid of sharing, with your provider earlier rather than later, so that together you all can work together to get on the right medication if that's needed, or to use the best approach for you for therapy as well. So those would be kind of the comments that I would sort of leave with everyone.
Well, thank you so much, and thank you for persevering to get on here, because I always like to hear what you have to say.
Yes, and let me just apologize for the internet challenges today,
Oh,
you know?
yeah, everybody has it sometimes. It's no big deal.
Absolutely. Unfortunately, it was a beautiful day here. So thank you, everyone, for tuning in, and thank you for connecting today, Kelly.
Yeah, thank you too. Bye-bye.
All right. Bye-bye.
Okay, and that was our guest at Dr. Kristie Norwood with an IE. And also, let me get back up here to Megan's. I know what it is. It has healing in it. At Healing Unscripted is Megan. So if you give both of them a follow, it'll really benefit you very much. And yes, Petra, she does rock. I agree with that. I'll be back in a couple weeks on Instagram, but next week I'll be on HealthyPlace Facebook Live. So maybe you can catch us over there too. And remember, you can go to HealthyPlace.com for information on mental illnesses and how to stay mentally healthy. You can also look on there and find out how to diagnose mental illness and try to figure things out a little bit so you can talk to your healthcare provider about any problems you might have. So thanks everyone for being here, and I will see you in a couple weeks.